Well, hello there, and thank you so much for joining AARP Massachusetts in Making Sense of Caregiving Costs. As you know, AARP is invested and absolutely working towards ensuring that our elders in our community have access to all the right resources and caregivers that will help them along the way. And now I would like to introduce Renee Sinis, who is one of our volunteer speakers with AARP Massachusetts, and her specialty is caregiving. So Renee, you can take it from here. Thank you so much.
Thank you, Janine. I'm delighted to be here with you tonight doing this presentation. This is a presentation on the AARP Financial Workbook for Family Caregivers. As those of you who are here tonight know, caring for a loved one isn't always easy. So in this session, we're going to introduce some of the essential information caregivers need to manage the complex responsibilities of caregiving. Our hope is that it will be educational and informative, and that you'll leave here today with more confidence in making your own plans, as well as a better understanding of how to plan for your care recipient. Next slide, please, Janine. Please keep in mind that this presentation is intended to provide general guidance, not specific legal or financial advice. Your individual circumstances may differ and should be taken into consideration before acting. Also, please know that although we will open this up to questions, I cannot provide specific advice or recommendations, but hopefully the information we cover will help you make informed decisions. Be sure to consult a professional for advice regarding your personal situation. So, let's get started. Being a caregiver is a labor of love that comes with a lot of responsibilities. While it's hard to put a price on caregiving, it also comes with some real out of pocket costs. You may be picking up groceries, helping with housework, making trips to the doctor or pharmacy. All the little things add up. Having a clear picture of what's involved, whether it's your care recipient's health, housing, or finances, will let you plan ahead and make the juggling act a little easier. That's why AARP has developed the Financial Workbook for Family Caregivers. This workbook is designed to help you focus on the financial aspects of your caregiving journey. We hope that these tools will help you feel prepared and to minimize the stress that financial decisions can cause. Note we'll use the terms care recipient and loved ones interchangeably, as both, of course, accurately describe the person for whom you are caring for. Agenda slide next, please. In this session, we'll review how to use the financial workbook. We'll also talk about how to incorporate practical financial tips into your caregiving, and we'll add resources to assist you. So a few ground rules. As Janine has already done, she has muted you. Remember, this is a public forum. If you are asking questions, please do not share personally identifying information. Use the chat or the Q&A to ask questions, and this is a judgment-free zone. Next slide, please. Did you know that family caregivers are thought of as an invisible army? But without adequate support, they remain vulnerable to financial and job-related hardships, as well as emotional stress. Let's look at some of the out-of-pocket costs associated with family caregiving. AARP estimates that family caregivers spend on average $7,242 on caregiving expenses out of their own pockets. These include things such as transportation and home modification. Slide 6. According to AARP's report, caregiving in the U.S. there are an estimated 48 million family caregivers, providing 34 billion hours of unpaid care to adult loved ones. Next. So what does that mean? It all adds up to $470 billion in unpaid care. Let's do a breakdown on the next slide of where that money goes. More than 3 out of 4 caregivers incurred some or all of these out-of-pocket expenses. Why did family caregivers incur these? Love, of course, but also because professional caregiving costs more. So I did some research and I found out that Genworth had done a study on long-term care costs. And Genworth is a Massachusetts company. They sell long-term care insurance, one of the bigger companies in the area. In 2024, Genworth estimated that the average cost for homemaker services, things like light housekeeping, meal preparation, running errands, at more than $7,000. The cost for a home health aide, someone with medical training who could assist with bathing or more personal needs, were about $4,000 a month more, adding up to about $80,000 a year. That's a significant number. So then I looked further. I'm in the Boston area, and I wanted to know what this was going to look like on an hourly or monthly basis. Home care in Boston ranges from $37 an hour to $39 an hour. Assisted living is about $6,750 a month or $81,000 a year. And nursing home costs can range from $465 to $505,000 a day or over $170,000 a year. So, from a strictly financial perspective, it's more cost effective to provide care for a loved one yourself than hiring a professional. So I told you I was going to tell you mom stories. My mom lived in Florida. I'm here in Massachusetts, and mom was determined to age in place. She wanted to stay in Florida. We were blessed for quite a number of years to have Felicia, with whom I remain friends to this day, as mom's caregiver. And when I say blessed, I have to say that Felicia started out a couple of hours a day, and then a few more hours a day, and then a couple of days a week, and then a few more days a week, until just around the time of COVID, Felicia moved in with mom and lived there 24 hours a day. So I can personally attest to the cost of caregiving and how that all plays out. So next slide. These costs, of course, do have their consequences. Many caregivers dip into their own retirement savings. Many caregivers spend less on their own health care in order to pay these costs. And more than a third cut back on personal spending to get the extra money they need to pay for a loved one's care. Next, please. About 3 in 5 caregivers, almost 24 million people, have a paying job in addition to their caregiving responsibilities. But more than half of family caregivers have to take time off from their main job, reduce hours at work, or even quit their jobs altogether to accommodate their responsibilities. This can mean diminished chances for promotions, less job security, fewer employment benefits, reduced money set aside for their own retirement, and lower Social Security benefits for themselves when their time comes. I want to read you an excerpt from an article in Investment News that came out just about a year ago. And it's in an analysis and commentary section. And it says, How Caregiving Costs Women Their Retirement Security. For most women, caregiving and saving for retirement are on a head on collision course. The National Partnership for Women and Families reports that a woman in her 50s, today's Gen Xers, who gives up her career for elder care, also gives up $324,000 in earnings and savings. It goes on to say elder caregiving often erupts unexpectedly and is unaccompanied by workplace benefits or structured support for the caregivers. The retirements of midlife women are caregiving collateral damage. That's a pretty strong statement. Caregiving collateral damage. And this is true, for men as well, if they've taken time off to care for a spouse or for their own family member. So more than a third cut back on personal spending to get the extra money they need to pay for a loved one's care or reduce their ability to work. So, what can you do to safeguard your plans? Plan plan, and plan some more. That brings us to the bulk of today's discussion, the financial workbook for family caregivers. The first page of the guide says it all. Dear family caregiver. The guide was designed to help you on your caregiving journey. It was created by AARP and Jessica Allen, an accredited financial advisor who is a caregiver for her husband. A few points to highlight here. First, the cost of caregiving is high, so please take note of our piggy bank symbol throughout the guide. We've added these so we could specifically point out some tips that could assist you. Second, every caregiving journey is unique. There's no one size fits all. Your journey is yours, and there are no right answers, just your answers. You may be able to finish this guide in a day, or it may take you several days, or it may take you several months. Whatever works for you is what works best. This presentation will simply hit on the highlights in hopes of helping you complete the guide at your own pace. Finally, this is obviously a sensitive subject, but we all know that caregiving can be very stressful, especially over long periods of time. Remember, it's just as important to take care of yourself, both your physical and your mental health, as it is to look after your loved one. So please do that for yourself, for that person you're caring for, and for all the people that care about you. Next slide is a video. Janine, if you could play that, please. Do we have our video working? Well, it's looking like we're having some technical problems, so I'm just going to explain the video to you. The video was done by Jessica Allen, who developed this workbook. And what she tells you on it, she was a caregiver for her spouse who was injured on active duty in the military. And what she talks about is who will know what to do if you need to take a break? Who will know where everything is if something happens to you? You are the linchpin in this caregiving, and therefore someone needs to be able to step in and help you. And that's where this caregiving guide steps in. The caregiving guide, as Janine has just posted in the chat, it was something you should have received with your invite. We're not going to go through it page by page, nor are we filling it out together. But I'm going to walk you through it to talk about what goes in each section so that you are aware of what it looks like. And if for whatever reason you did not receive a guide, reach out to AARP and we will be sure to get one to you. So next slide, please. Today, we are going to provide financial tips in 4 categories: health, housing, money, and the future. I'm going to stop at the end of every section to take questions. So please remember, put your questions in the chat or the Q&A. And at the end of every section, I'll stop and Janine will read the questions and I will attempt to answer them. Remember again, this is not unique to your situation. Personal finance is called personal for a reason. There's no one size fits all solution. And this guide is designed to help you in some more specific detail. The guide is going to be a key resource to equip someone to step in and assist your care recipient in the event of your absence. We also strongly suggest you seek assistance from professionals. So you're going to see in the legal section, there's a power of attorney and a will section, but these are not powers of attorneys and wills. You still need the assistance of an attorney. So once you list all your debts, you can also seek the assistance of an accredited financial counselor. So the guide is designed to help you through the process, but not to replace trusted financial or professional advice. First up, next slide. Let's talk about the health section, where we're going to begin documenting plans for the health care of your loved one. We'll cover a wide range of topics, including health, sickness, and even death. These topics can be difficult to discuss, but it's vital to make the right plans. Before you begin filling out each section, you'll want to take the time to gather the key information that is going to help you. For example, before completing the healthcare section, you want to collect all of the contact information for your care recipients, doctors, hospitals, and pharmacy. And I have to tell you, one thing for me, cookies. Cookies go a long way to helping me do anything, not wine, because then you don't get anything completed, but cookies are a great help. Next slide, please. We're going to start with the healthcare plan, which begins on page 5 of the guide. You'll want to answer some very important questions about the care your loved one receives. First, from whom do they receive care? Is it Medicare? Is it the VA if they're a veteran? Do they have supplemental private insurance? With so many possibilities for healthcare coverage, make sure you take the time to understand not only who the insurer is, but learn about their caps, copays, deductibles, and the coverage. On the next page of the guide, you'll list health issues, medications, and accommodations. This page can be extremely helpful at any and all doctor's appointments and hospital visits. And emergency contacts are a must for any caregiver who can step in for you with little notice. Hopefully, you will have more than one person who can jump in. What other details can you add to this page to help medical staff with your care recipient? Does your healthcare recipient have allergies that they need to be aware of? Do they have difficulty hearing or seeing? Do they live with memory loss or dementia? If you filled in the accommodation area above, add those details in as well. My mom was very, very hard of hearing and hated wearing her hearing aids. So she would, just get up in the morning and not bother to put them in and couldn't hear a word you were saying. And it was very helpful for someone to know that you needed to be looking at her and talking to her or to remind her to please put in her hearing aids. Next slide, please. As a caregiver, oftentimes you may feel alone, but you're not. Make caregiving a team sport. In this section, you'll document all necessary contact information, such as names, addresses, phone numbers, email addresses, and websites. Your care recipient's care team should know you and consider you, the caregiver, as one of the most valuable team players. Caregivers can provide medical professionals with crucial information that can make a big difference, and caregivers can also provide crucial information and details that the care recipient forgot or perhaps didn't notice. You might want to check if your state or the state where your loved one resides and gets medical care has passed a version of the CARE Act. The CARE Act makes sure caregivers are recognized when their loved ones go into a hospital, are notified when the patient will be released, and are given instructions they need for continued care before their loved one returns home. You can even go to aarp.org/wallet cards to download your free CARE Act wallet card for yourself and your loved ones. Fold the cards and wrap it around. The cards fold, so wrap it around the insurance cards, wrap it around the Medicare card, and place it in your wallet. Next slide, please. Oh, before we go on to the next slide, I just want to tell you, again, going back to stories about mom, as I said, mom was in Florida and I was up here. Well, Felicia was obviously in Florida. And originally, I was listed as the contact person for all of my. So if mom went into the hospital or went to the doctor, and she had one of those I've fallen and I can't get down buttons, and I was listed as the contact person. And we quickly realized after I had gotten notified one day, well, if you live in Massachusetts, you know what Route 9 in rush hour looks like. I was traveling on Route 9 and I got a phone call telling me mom had gone to the hospital. And I could not make them understand that I didn't know where they had taken her because they kept saying the hospital right near her, around the corner. So we quickly realized that the contact person needed to be Felicia, who was right there. Even if she wasn't with mom, she lived 15 minutes away. And this is where the CARE Act really came in handy because she was able to be the eyes and ears and the feet on the ground. Okay, so let's think about your healthcare team. Who provides support for you? Do you have a secondary caregiver that steps in? Do you have an adult child or grandchild that comes in? Do you have a neighbor that simply runs to the grocery store? Mom had a wonderful neighbor, Dennis, and I knew that if I couldn't get hold of Mom by phone, this is kind of in the years when Felicia was only there part-time, I could call Dennis. And Dennis would go over and check on Mom, and he'd come back and tell me, yeah, she's fine. She just didn't hear the phone ring, or because she didn't put in her hearing aids, or she's fine, but she hasn't gotten up yet. And I would say, Dennis, can you check back in 45 minutes and please make sure Mom gets out of bed? So who do you have that can provide that support for you if you're not there? Is there a church or community-based group that you're a part of? Can someone from those organizations assist you? Do you have someone you can talk to about the stress of being a caregiver? So any and all these people should go into this section of the guide. Again, the idea being, if you are ill or if you need to take a break, who's going to step in? That this person who's going to step in and relieve you has essentially a handbook of information that they're going to need, that they're going to use to be able to help your loved ones. And we'll provide you with information on some resources that can assist you later in the presentation. But I'd like to mention two things that can really help if you do need to take a break. One is respite care. Respite care is a short break from regular caregiving duties. A 2015 National Caregiving Survey by AARP found that 85% of caregivers would find respite helpful. Sadly, access to respite is often limited by location, income, and the health condition of your loved ones. One of the links we'll give you later in the booklet will contain and in this presentation will contain information that might help you to find respite care in your area. The other thing is adult daycare programs. Sometimes councils on aging have adult daycare programs. Some nursing homes provide adult daycare. So, isolation and loneliness are a real counterpart of caregiving, both for you and for your loved ones. So, you may be able to find some of these through your local council on aging. So I'm going to stop here for any questions before we move on to the legal section. Janine, if you have any, or if you can think of any, please let me know.
Right now, there are no questions in
Okay.
the chat.
All right. So again, please remember, put your questions in chat or in the Q&A. And I am going to move on then, and we'll go to the legal section. So as we talked about before, this is a section that will does the Caregiver Act allow the caregiver to pick up prescriptions? I'm saying, yes, I believe it does. And I know that Felicia picked up all of my mom's prescriptions. She wasn't, she no longer, my mother no longer drove. And again, I was up here. So yes. And the pharmacy and the doctor knew who she was. So I think that's very, very important that you make those connections and those relationships. All right, moving on to the legal section. A power of attorney. So power of attorney, this is an extraordinarily important document. Everybody should have a power of attorney, whether you are in perfect health or you're not in perfect health, you should have a power of it. Anybody over the age of 18 should have a power of attorney. A power of attorney is a signed document in which a person appoints someone else to act on their behalf while they are alive. Powers of attorney are sometimes limited to a particular purpose or period. Other times they're general. So a limited power of attorney, I sold my house a number of years ago and I wasn't going to be able to be at the closing because I wanted to go on vacation. So I gave my real estate attorney power of attorney to represent me at the closing. But I also have a general power of attorney, which gives one or the other of my children the ability to step in and act for me if I am alive but incapable of making decisions. And that can be that they can access my bank account, they can pay my bills, they can sell property for me, they can make trades in my brokerage account, and A power of attorney. So what you're going to see in the guide is a power of attorney worksheet. Remember, this is not a legal document, so fill out this worksheet. Who is going to have access to your bank accounts, your caregivers, your care recipients' bank accounts? Who can make business decisions for them? Who can sign contracts for them if you need to, have a new phone or cable or something of that nature? And remember that you need to have this document actually completed by an attorney. It needs to be witnessed and it needs to be notarized. So any medical decision or financial decision, you need to have a power of attorney. So you can have different, please explain about bank accounts. Can you just expand upon your question a little bit more and I will come back to it. You can have different powers of attorney for financial or healthcare issues. You can name multiple people to act for you. I prefer to have people in succession. So if you name two people to act for you, then those two people may need to agree on what they're doing, which can be very, very cumbersome. So I would say name one person. If that person can't serve, name the next person. If that person can't serve, name the next person. Again, make sure that you have this finalized by an attorney. Also, please note that some power of attorneys are not as widely accepted as they were in the past. Some financial institutions have their own powers of attorney, and we've run into that as a problem in the past. When I say we, I'm a financial planner. So if you have accounts at Fidelity or Vanguard or UBS, check with them, find out what their power of attorney forms are, and get them signed as well. All right. Remember, a power of attorney form from done by an attorney, as well as a power of attorney form for any financial institution, and that could include a bank. All right, I'm going to stop on power of attorney because I think we have lots of questions. Go ahead, Janine.
The first question is explain. Oh, you wanted the registrant to have explain more about the banking question. And she's explaining that if her family needs to get access, like her daughter.
Okay, so then you or whoever's bank account it is, let's say it's yours, you're going to sign a legal document called a power of attorney, and you are going to give your daughter becomes what's called your attorney in fact. She will be able to step into your shoes with the bank and then ask the bank if they have their own form that you would like to have, that they would like to have filled out, and that will give her access.
And there's one other question.
Go ahead.
Is there a way to claim caregiver costs on your taxes? Because my husband is not my dependent. We filed married filing joint. I was not able to claim the annual cost I paid.
So I'm going to say that there is a bill that AARP was instrumental in passing that allocates costs to caregivers. I'm going to tell you that I don't know enough about it, but we can get information to you because that was one of the agendas that AARP had. And there's also a way on your taxes, if your medical costs in general exceed a certain percentage of your income, I believe they can be an itemized deduction. Okay, we're going to keep going on. And yes, and Janine is just saying the bill was passed, so there is an allocation for caregiving costs, not necessarily on your taxes. So your power of attorney, where you keep it is vital. Don't put the original in a safe deposit box unless someone has access to that safe deposit box. Fireproof storage, fireproof filing cabinet. Also give a copy of the power of attorney to the person you are designating. Remember that a power of attorney, when signed, is an effective document immediately. So it does give someone access to your accounts. Be very, very careful who you give these copies to. Make sure that somebody knows that they can access it when needed. So we're going to move on from power of attorney to the next slide, which is wills and estate planning. And like a power of attorney, the actual will or estate planning document is going to need to be done by an attorney. Please do not do one of those online complete your estate planning documents. Please go to an attorney. And this is where you talk with your caregiving recipient and for yourself how they would like their estate to be distributed upon their death. Who gets their property? Who gets the house, the car, the bank accounts, the retirement accounts? So take some time to work on this. Take some time to answer this for yourself as well. And this takes the guesswork out of what happens if someone passes away, and in terms of distribution of their assets. And these two are documents that should be, I prefer to keep mine with the attorney who drafted my estate planning documents, and a notation to my kids that my estate planning documents can be found there, and a copy in my file cabinet, again, not in your safe deposit box. And the next slide, please. All right, so this is a difficult yet necessary topic because it's very important to make your final wishes known. A lot of people have a paragraph or a clause in their will about their final wishes. My feeling is that's kind of too late. Not everybody goes scurrying for your will. People need to know what your plan is. So this is where if the person for whom you are caring still has the competency to talk about this is the time to sit down and have a conversation, perhaps bring in an adult child to be part of this, to talk about what your end of life plans are, both for you and for the person for whom you are caring. End of life costs are also important parts of this to consider. Do you have enough savings to cover burial costs? Do you have enough life insurance to cover burial costs? Don't leave the expenses to your loved ones. So please plan ahead. And I'll take a question in a minute. I want to tell you, my mom, bless her, had a prepaid funeral. And, mom again was in Florida. I'm in Massachusetts, but our family cemetery plot is in New York. And mom's prepaid funeral made all of this seamless. I was able to call them. They told me exactly what to do if mom passed away at home, which she did. And it was not to call the funeral home. It was actually to call the police. They needed to come and certify mom's death, and then Felicia could call the funeral home. The funeral home in Florida took care of getting mom to New York. They connected me to a funeral home in New York who took care of getting her out to the cemetery. And then the cemetery took care of helping me plan the New York funeral and a graveside service. So think about, setting up that prepaid funeral, take that burden off of your loved ones, and eliminate that they have enough to deal with if you were to pass. This is some way that you can help them. So we're going to stop at this point because we're done with the legal issue. And we're going to take questions about the legal issues.
Yes. The first question is from Veronica, and she wants to know what if you and your spouse are legally married? He's a veteran. Can you get power of attorney if he passed away?
So power of attorney, and so you've combined a whole bunch of different topics.
I was just
So,
gonna say,
which is that you're legally married, a veteran, and power of attorney. So power of attorney, all of those things have no impact on power of attorney. A power of attorney can be given to anybody, whether you're married to them or they're a veteran or anything like that, but it's only good while you're alive.
I'm sorry, Renee. She
Yeah.
actually corrected her question and said, correction, not legally married
Okay.
to your spouse who is a veteran.
Doesn't matter if you're married or not. Again, power of attorney can be given to anybody. I'm single. My power of attorney is going to my children, and then I will have another a friend. If neither of my children can serve, I will leave power of attorney to them. So power of attorney is given by the person. So it's your husband or the person you're caring for. They have to be legally competent in order to sign a power of attorney. So if you're talking about somebody who already has dementia, you may have passed the point at which you can execute a power of attorney. And that will be for the doctor, maybe in conjunction with you to decide. But again, a power of attorney, this is just the person you would like to step in and handle your finances if you're alive, but not capable of handling them yourselves. And they don't have to be any legal relationship to you. So I hope that answers the question. Any other question on that, Janine?
No, we're all set with questions.
Okay, so we're going to move on to talking about housing and diet and allergies and transportation and things to think about for you and your care recipient continuing to live in the community. This section is intended to help you and your loved one get your home in order. If you live separately from your care recipient, you might want to take the time to fill out these pages for yourself as well. Make sure you list due dates, amounts due, where the payments go, and all other vital information. You don't want to miss or be late on a payment. So make sure you do this for all bills related to your care recipient remaining in their home, the mortgage or rent, homeowners or rental insurance, property taxes, and all household utilities. Check with the utility companies to see if budget billing is available, which can allow you to pay the same amount every month rather than get hit with higher costs in the winter months when the heating bill goes up, or higher costs in the summer months when the air conditioning bill goes up. Also, don't be afraid to ask for discounts. For example, there may be a discount for someone who's in the military. Tax-free or reduced property tax exclusions can also be available through your town or your city, and that can save you a significant amount of money. My mom had all of her bills on auto pay, and Felicia and I thought, we were really on top of this because they were on auto pay. When mom passed away, we found out that we'd kind of goofed because she had put some bills on auto pay from one account. I had put some bills on auto pay from another account, and still other bills were on auto pay from her credit card. And we didn't have online access because everything now asks for two-step verification. You log in and it goes to a cell phone, and the cell phone it went to was my mom's flip phone that she hadn't used in 5 years. So if you are setting up auto pay, make sure that they're all being debited from one account, that you consolidate, and that you know how to do the two-step verification, that it's coming to your phone so that you can get online access to these things. Next slide, please. Transportation, we're going to move on to transportation. And transportation is a very important factor in your care recipient remaining in their home. Do they still own, operate, or drive a motor vehicle? If so, use these pages to list all the information needed to own and operate a vehicle in your area. If you're the driver, use these pages to fill out the information for yourself. Make sure you check with your local town or county clerk to see if you're eligible for any discounts. For example, Purple Heart recipients in Texas receive free license plates. Many other states offer similar types of benefits. Some states require automobile owners to pay property taxes on their vehicles. Massachusetts calls these excise taxes, and they're assessed every year. So make sure you know if that's the case in the state where you live. When my mom first started needing care, at least, even only part-time, she was still driving. Heaven help us all at that point. But shortly after, she stopped driving, and Felicia was driving mom's car. So even though she had her own car, for the most part, she used my mother's car. And we spoke with the insurance agency and found out that it would be very prudent to add Felicia as an operator on my mom's car insurance. So if you are providing transportation for somebody who is not a member of your family, who's not also on your insurance policy, find out if you should be on their insurance. Just don't want to find out that you're not adequately insured if unfortunately you have an accident. Next slide, please. So this is a page where you're going to put in whether or not you or your care recipient have a special diet. Are there food allergies? This page can also serve as a shopping list if someone needs to come in. You know, you're not well, someone needs to go grocery shopping on behalf of you and your care recipient. Are they gluten-free? Are they allergic to shellfish? What other kinds of allergies might they have? Are they lactose intolerant? So put all these things in. Also, if there are serious allergies, like needing an EpiPen kind of allergies, put that in here. Are there any drugs that they're allergic to? So put everything down that someone coming in to replace you or for you yourself need to know about your care recipient. Any food allergies, any allergies, medication allergies, things of that nature that will make it easier. And the idea behind this is to have all this information in one place so it's easily accessible and available. Next slide, please. And this is why I would say have it all in one place, easily accessible and available. Keeping documents secure is a necessity. So you might want to consider getting a home safe or a locked file cabinet. And the contents of every safe or file cabinet are going to look different. We all have different vital documents. We've talked about the will and the power of attorney as two of those. This list here is simply to help you get started. Some of the documents might not be relevant to you at all. Make sure that this safe or file cabinet locks and that you keep the keys in a separate place. So one of the things you might find is that you have paid caregivers coming in and out of the house, and you want to make sure that your vital documents and your bank records and your investment records are all somewhere safe and that someone else has a copy of these. So you might want to give your daughter or your son, if they don't live with you, a separate set of keys, and you have one for yourself. And then maybe if you have a good friend or another family member. So just make sure that you have enough sets of keys that someone can access these documents on your behalf. Next slide. And this is very similar to just what we're talking about. Like the safe contents, some people have a safe and a file cabinet. Some people just have one. But again, an extra set of keys. Remember where you put those keys and make sure that you let the people who have the keys know who has keys and how to get in touch with one another. So we're going to move on to money. Before we get to money, let's see if we have any questions on where to keep vital documents and keeping things in safes and file cabinets.
Well, we don't have any questions about that, but we do have a couple of power of attorney questions.
Okay, let's go back to
Um,
those then.
yes, Tiger Lily wants to clarify, please. Power of attorney is a legal document prepared in advance. It's not an automatic spousal right, correct?
That is correct. So the only right your spouse has to access your accounts is if they are also co-owners on those accounts with you. But for example, let's say you are let's say you're suffering from dementia and you and your spouse are both on a deed to a house. And your spouse says, we need to sell the house to downsize or maybe move into an assisted living facility, and you're not capable of signing a deed, your spouse can't sell the house without getting appointed as your guardian. A power of attorney would give your spouse that right to sign a deed on your behalf. So it's not an automatic spousal right.
Okay, the next question comes from Marcia, and it's regarding driver's insurance. Even though my mom no longer drove, do we keep her on the policy?
Is the car titled in her name? So that's a question for your insurance agent. My mom no longer drove, but she had
Yeah.
a car that was titled in her name. Therefore, she needed to have auto insurance. And that's where we added Felicia as the driver. So talk with your insurance agent.
There is one more question from Chris, and he's asking, have you ever heard of the NOK box? NOK means next of kin. It is all this information organized in one box.
Oh, that's wonderful.
I guess it wasn't a question. It was
Yeah,
just a
so
comment.
very similar. Thank you for sharing that. There are lots of ways to do this. This is just this seminar is more geared toward the caregiving piece of it. The idea of leaving something or information for your next of kin or your heirs is wonderful as well. Maybe a next step after this. So thank you for sharing that.
Thank you, guys. If you don't have any more questions, we'll move on.
All right, we're going to move on to money. So one of the most important responsibilities as a caregiver is planning and managing money, both your own and your care recipients. Home is where most of us spend the majority of time, and it's important to make your home a low-stress environment. Though difficult, discussing money doesn't have to be stressful. Take the time to make your dollars work for you and your care recipient to create peace of mind. In this section, we're going to discuss budgets, investments, and debt. Next page, next slide. The first page is a budget page for you, the caregiver. If you're married to your care recipient, combine your budgets. If you're not married to your care recipient or living separately, you may want to do a page on a budget for you as well. So it's vital that you give every dollar a name. When you're caring for someone and managing their finances, you really need to start tracking dollars. You need to know what those bills are. You need to know what's coming in. Is this Social Security, a pension, a VA benefit, income from investment accounts? Start thinking about every dollar that's coming in, where it's coming from, and how much money is showing up every month that you are aware of. And then you want to start looking at what money is going out. Is it going to a mortgage, rent, property taxes, the cell phone bill, the cable, food, car insurance? So you should be able to have every expense have a line item on this budget. And if this budget page doesn't work for you, you can do this on an Excel spreadsheet. You can do it on a computer program. You can do it just on a piece of paper with columns. Just whatever works for you so that you know where all the money is going. If money is left over at the end of every month, you can allocate that to savings and talk about whether or not that's going to go into a bank account or an investment account. But the idea behind that is to track your income and expenses. AARP offers an AARP home budget calculator that you might find very, very useful in doing this exercise. Next slide. So there's another budget for caregiving because we realize that there are specific expenses relating to caregiving. As we said before, caregivers spend thousands of dollars per year caring for others. So take the time to list out your caregiving expenses separately from the budget you've put together for your finances. We've also set up a sheet to prepare a budget for the care recipient. So remember that unless your care recipient is your spouse and you've done a combined budget, your budget is going to be different than the one you filled out for your care recipient. Next slide, please. Investments. Investments can be tricky. So you need to not only have money to invest, but you also have to decide what your investments look like. And this is where, as power of attorney, you would have the right to access someone's investments if your name is not on the account. And you might want to take a look at if there are investment accounts. Do these investments currently fit your care recipient's needs? Are they too risky? Are they geared to somebody who's much younger and has a longer time horizon? This is where a financial professional comes in. So spend some time researching the investment companies, decide which ones are best for you, talk about fees and commissions, and it should go without saying that you want to be making more money than you're paying out in fees and costs. AARP has an interview and advisor tool that's a free resource to help you understand an advisor's credentials. And many organizations, as we talked about before, have their own power of attorney. So please make sure that you check with the organization to find out what their power of attorney is. And I'm going to read you an article. This is actually from AARP, and it came out in the AARP magazine, The Money Saver. And it says, when best laid plans go wrong, what to do when your financial institution won't accept your power of attorney. And it said, Kristen McDermott had power of attorney for her mother who had dementia, but two financial companies, Vanguard and USAA, wouldn't let McDermott act for her mother. They were able to eventually resolve it, but you don't want to have to come across that as a crisis when you need access to the money. So if you do have money at a financial institution, and I encountered the same thing with my mother at UBS, I had power of attorney, but UBS wanted their own form. Fortunately, mom was still capable of exercising one because at a later date she would not have been. So please contact all financial institutions about their own forms. Okay, next slide. I'm going to talk fast because we're running out of time. The debt page, similar to your knowing where money is coming in, you need to know whether or not there's any debt. This can be a mortgage, if there's still a mortgage, it can be a car loan, it can be credit card debt. Make a plan to knock out debt. Most financial experts recommend organizing debt from smallest to greatest. You can also organize them from the one that charges the highest interest rate and knock off those first. There are financial strategies. Check out the AARP Money Map to help you deal with taking a bite out of that debt. Next slide, please. And then we're going to talk about what does the future look like. It's important for you carefully to consider what the future looks like. What are your goals? What do you need to do to achieve those goals? Do you have a retirement plan? Do you personally need to save more for retirement? And how might your caregiving responsibilities affect your plan? Use information from the financial section to evaluate your options, and we've included a page for the caregiver as well as the care recipient. These plans could be similar or they could be vastly different. And then lastly, we're going to give you some resources. There are resources in the caregiver book that you have. We've also got a place where you can jot down some additional notes if that's helpful to you. If you want to move to the next slide, Janine. There are resources and key terms, and as I said, they are in the book, so you don't really need to copy them down right now. We have a caregiver resource in English as well as Spanish, a Prepare to Care guide, which is available online, and an AARP Family Caregivers discussion group on Facebook. So you don't need to be an AARP member to join. We hope you will be, but know that there are resources. And also, as we said, this is being a caregiver can be stressful. There is a National Suicide Prevention Lifeline that is listed in your book. They have staffing 24 hours a day, 7 days a week if you are feeling overwhelmed. So are there any last questions before we conclude?
There are none at this time.
Okay, well,
But I will say you did get some comments. Very good and informative webinar. It truly is. Thank you so much.
Well, thank you all for joining us today. I hope you enjoyed the presentation and you got some resources you can use. As I said, we've reviewed financial tips for caregivers within 4 categories: health, housing, money, and your future. And we've shared some additional resources with you for your caregiving journey. We hope you stay connected with AARP and look forward to seeing you again on another webinar.
Thank you all for joining us. My name is Janine Humber, again from AARP Massachusetts, and I'm so happy that you guys were able to join us. We will be sending you out the handout, the workbook, and you will receive a recording of this webinar. And if you have any questions, we will absolutely forward them to Renee for you. Thank you and have a good evening.
Good night, everybody.